Hi, I'm Dr. Mirafiti from Miro Aesthetics. We're continuing our series of video about breast implant or breast augmentation and covering different topics or different questions that most patients have about doing an augmentation or implant placement. So the next question is, what is 45-55 boob rule, or what is 45-55 breast implant rule? So that basically entails where you're going to position the implant. So I have a couple of implants. That also depends on the types of the implant. So this is a high profile silicone implant. And you can see the implant has a diameter, which is the width, or if you will, distance from one size of the implant to the other side. And also has a projection. So we're not talking about projection right now. We're actually talking about the width when we're talking about the 45-55 boob rule or implant rule. As you can see, there's a little circular on an implant. So most doctors try to match this with the center of the nipple areolar complex. Your nipple obviously is the nipple, and the areolar is that brown part around the nipples. And you want to put this on the nipple. Now at Miro Aesthetic, I like to use that rule of 45-55 because I like to put this a little bit below the nipple areolar complex, which means the 55% of that implant is underneath the nipple areolar complex and 45% is above it. Now obviously there's not a mathematical measurement we can actually do, but it's sort of the same thing, 55-60, 60-40, 55-45. But basically what it says, you want to put little, not half, but little bit above the half of the implant should be placed below the nipple areolar complex, which give you the result of, you can see when you're standing up, it gives you a result of a little bit fuller breast on the bottom, and you're not too top heavy. So you sort of have the natural curve what implant has. Now, if you go to the extra high implant or the boost implant, you can see the diameter is a little bit narrower, but a projection is higher. So that's all that 45-55 or 60-40 also depends on the types of implant that you are using. If it's a moderate implant, then again, diameter is going to be wider and the projection is going to be less. So I think the 45-55 or 60-40 rule it's a good rule to follow if you're looking for a natural looking breast augmentation. Obviously, if you're looking for an unnatural look, and there are patients that come in and they ask, oh, I want to be as fake as possible. Now, I don't advocate that. I think the whole idea about breast augmentation to be sort of guessing, hey, does she have an implant or doesn't have an implant? If you have it high up, then obviously it's dead giveaway that you have an implant. So if you are looking for that unnatural look, you want to use the 50-50 rule, or even other way around to do the 60-40 rule, so you be basically more top heavy. Now granted, if you're under the muscle already, remember the under the muscle, it gives you a little bit of that fullness on the upper pole of your breast anyway, because now you have muscle introduced into the equation. So at Miro Aesthetics, I always advocate the 45-50 or 60-40 rule because it's just more natural look. Also, the size of the implant is really important. A lot of people say, hey, what size should I go? That rule also applies to how much breast tissue you have. So if you want to be more fake looking, you basically put more of that implant than your breast tissue. So you sort of guesstimate what size your breast tissue is. The best scenario is that 45-55, that basically the implant is about 55% of your breast. That looks more natural to touch, to feel, to look, because breast you have is about 45% your own breast, 55% is the implant look. That gives you the most natural look, and if you go the other way around, it's the most, as you go up the spectrum, it becomes more unnatural. So stay healthy, stay well, and we're going to continue our series of questions. You guys can watch this whole series. Take care.